This is Talk to Kedi, sharing knowledge, liberating knowledge. Hello there. Thank you so much for joining me on another edition of your number one educational online broadcast, Talk to Kedi. Our topic of today is Parkinson's disease. In other words, we'll be discussing in details what Parkinson's disease is, its causes, common symptoms, the people who are susceptible to it, how it can be detected, prevented, and effectively treated, as well as the steps we can take to manage and also improve the quality of life. My name is Felix Adeyemi. Stay tuned and get ready to learn. To do justice to today's topic is one of our top leaders. He is one of our honorary lecturer, the owner of Service Center 294, located in Lagos. He is also a highly knowledgeable TCM consultant. Please join me in giving a warm welcome to Mr. KEHINDE Adeyemi, popularly known as Kenny Kedi. All right, thank you, sir. Sir, could you do us the honor of introducing yourself to viewers at all?
My name is Adeyemi KENNY, Honorary Lecturer in KEDI Healthcare, with a lot of past knowledge in traditional Chinese medicine. I've moved around the world, both within the countries and outside the country.
All right, thank you so much for coming today, sir. We are so delighted to have you on the show today. So, if you're tuning in for the first time, this is Talk to Kedi, your number one educative online broadcast come to you from the stable of KENNY Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and services nationwide. Welcome on board and stay tuned. Today, we are focusing on a condition that affects millions of people around the world. Yet, many still don't fully understand it. That's Parkinson's disease. It is more than just shaking of hands or the slow movement. It is a brain it is a brain disorder that can change the way someone walks, talks, and even expresses themselves. Now we're going to our statistics. Let's go to our statistics. Do you know that as of today, over 10 million people around the world are living with Parkinson's disease, with a global prevalence estimated at 1.51 cases per 1,000 people as at 2023. In fact, a 2025 BMJ-based projection carried out by Parkinson Europe estimates there will be 25.2 million people living with Parkinson's disease by 2050, which is 102% increase.
That's alarming.
Very, very alarming. That's a 102% increase from that of the statistics we had in 2021. And indeed, 89% of this growth primarily are driven by population aging, while also 20% are followed by population growth, and then 3% of it is due to disease. It will amaze you that also in Nigeria, studies report that crude prevalence estimates from approximately 10 to 249 per 100,000. Hospital-based data also suggest more men are affected and onset often around the early 60s, with approximately 14% early onset in one cohort. So, Mr. KENNY, based on your clinical experience, how accurate would you say these statistics are?
I would say just something like 75%.
75%.
Do you know why I say that?
You go ahead, sir. Explain.
Yeah, because most of the people they put in that category,
Yes,
they are also suffering from what they call stroke.
Mm.
If you have developed that particular challenge, they will still they will remove you. If you want to do it perfectly, they're supposed to remove those who are suffering from the Parkinson's disease separately from those who are suffering the stroke. But they are always co-op together.
Together.
Do you understand?
Yeah, I get
But 75% they are high.
All right. Wow. All right. The show has started. Don't forget, you can be part of the conversation in the comment section. Let's connect, share knowledge, and also learn together. Click the link and share it with everyone you know, and invite them to join us in this edition in learning about Parkinson's disease, its causes, symptoms, and way to manage it. If you have any question, now is the perfect time for you to send in your questions. Please drop them in the comment section and we will address them all. All right, over to Mr. KEHINDE Adeyemi as he takes us through Parkinson's disease. Sir, are you ready, sir? All right, let's go to my first question, sir. I would like to ask you for my first question. To someone hearing about Parkinson's disease for the first time, how would you explain or describe it to them?
Thank you. Parkinson's disease, we normally call it PD,
yes,
is a brain disorder that has to do with stiffness and uncontrollable movement. That normally associated with it, at times with the shaking, tremor, then or movements on certain part of the body. Then we have what they call motor aspect of it and non-motor aspect of it. You understand? The non-motor aspect is when somebody has started having challenges gradually, unknowingly to them, that they've already having a Parkinson's disease when they have what they call loss of smell.
Exactly.
That's how it normally started. You understand? And they don't take care of this thing particularly very well. It can escalate to something they won't be able to control. That you can take care of their inability to walk or move around. Even at times it can normally affect their speaking.
Their mode of speech. That is okay. Wow. All right, sir. So that takes me to my second question.
Okay.
Since Parkinson's disease is often diagnosed after symptoms have already started to manifest in such an individual. Okay. So what are the early signs, the early warning signs people should look out for? And you understand what you should look out for before the condition becomes so worse or even more severe? What are the early symptoms?
As I've said, when we are talking about the definition of what is Parkinson's disease, yes, sir, we have motor aspect of it, non-motor aspect of it. Yes. The motor aspect we have to do with your inability to hold some things. You understand? Let's say your hand is shaking of hand, tremor, shaking of hand, or stiffness. Yes, yes. You understand now? So those are the early stages of it that be able to know what is wrong with me. You are picking barrel.
It becomes so hard to hold or to use.
Okay. You understand? That's the early stages of the Parkinson's disease. Then inability to walk gradually will be coming in. If you don't take care of it, it will escalate to that level. Then the non-motor aspect of it has to do with inability to smell, loss of taste, constipation. You understand? Fatigue. You understand? So when these people, especially when this thing happen gradually like that, some people think it's one of those things.
You wouldn't know.
You wouldn't know because it do normally crop in unexpectedly. Because when it comes in, you think it's not those things. But it's normally associated with ages. As you are aging in life, when that thing comes in, it's a serious challenge, especially to the men. Women don't normally have a Parkinson's disease most, but 90% of men, we are not careful.
Wow, this is very, 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 very strong. So, sir, that's taking me to my third question. Are there known causes or risk factors that can make someone more likely to develop Parkinson's disease? Let me split it into two like that.
You say that I have. Parkinson's is one of those. This is normally called idiopathic. There is no known causes for it.
Wow.
There is no known causes for it.
It just happened.
It's normally associated with the age, the way your previous lifestyle.
Okay.
You understand?
Yes.
Associated to some exposure to some chemicals and the way of work you have been before. Most of the people I have been able to handle some people who work within the cement factory environment.
Okay.
You understand?
Yes.
Then those who work who normally do this more handling machines, hard job.
Okay.
That before they can mostly the drilling.
Okay.
So as they are pulling the thing down, it's affecting the muscle, shaking their system. Eventually, when they don't do that kind of job again, at the later age of their life, they are going to have that particular challenge.
Wow.
There's no way they can handle it.
So, normally when you're doing that, certainly their body is shaking.
Yes.
So once they stop
It's
it,
affecting the
they will
nerves.
find themselves shaking
Yes.
also.
Let me give you an example.
Okay.
Let me give you an example.
Okay.
They normally tell you that don't put your phone here at the pocket side. You understand?
Yes, sir.
If you have been able, you have found the habit of putting the phone at this particular side, it will condition the nerves here. Do you understand?
Yes.
In the why you don't normally put the phone there again, at times you'll be feeling that something is vibrating on your body. And there was no phone there because that nerves has been conditioned
to have that feeling
that
the phone is there.
That the phone is there. That vibration will be there as long as you are living. Wow. Are you with me?
I'm with you.
Let me give you another example. Okay. I've traveled often through the aircraft, every other thing. Go and check 99% of the pilots at the later age of their life, they normally have early age challenge. Because when the plane is about to take off, there are a lot of challenges, especially with here. Some of us that have been traveling with the flights will know that at times your head will be blocked, your hair will block, you won't hear anything again. What do you do? To bring it back to life. You understand? So that is normal. And at the later date of their life, they will have the hearing challenge. So you have to at least look at the kind of work you are doing. You understand? Yes. And look at what's going to be the aftermath of that work if you are no longer doing.
Wow. Okay, so sir, what challenges with this now? What challenges do patients face when patients face in getting an accurate diagnosis? And what are these challenges? How can they be overcome?
As I've told you, there is no particular way to discover somebody is having Parkinson's until it's manifested itself.
Okay.
And you know, in Africa, our major challenge is technological challenge. We don't have enough equipment. And when the equipment is available, there is no much technical know-how. People can use it and give us what we need. That's why the so-called our leaders normally run the way.
So over there to go and treat themselves.
Because what they are doing here is gambling. And if you want to die faster, you will never like to play Ludo with your life. It's as simple as that. Because who are we? The common people who doesn't have anything to do.
So how do we do it?
We come back to where we belong to and work with KEDI and some other.
Thank you, sir. So that takes into my next question, sir. That's my fourth question. We all know that it's a prevention is better than cure. So how can Parkinson's disease be prevented?
As I've told you, there is no way to prevent it unless you take care of your normal. There is normally thing I normally give to people. Some of my clients say that you have to follow what they call RED. I give it that acronym, RED. What is RED? You rest adequately. Okay. You exercise and maintain a balanced diet. Okay. You understand? Yes. If you can follow that kind of a line and change your lifestyle when you are aging, you are changing your lifestyle. If possible, stop drinking alcohol.
You can just chip in what lifestyle should such an individual start doing.
Exercise regularly. Eat fruits regularly. Okay. If you normally follow taking alcohol, stop it. Don't smoke. And move away from anything like chemical lifestyle. It's possible if you can walk towards your own life. Some of us within our own environment, you can have your own flower pot. Let it be your fresh vegetables. Okay. Instead of putting flower there, put vegetables, mini garden for yourself. Okay. And within your environment, don't let it be all these chemicals, radiating agents that are available, like all these masks.
All those masks.
You know, I don't want to talk about that because it's not our field.
Of course.
Whoever they put masks in the environment, the first 10 billion within your environment, they have collected the money of their life.
Actually.
You understand? They're supposed to leave that environment, including you, supposed to leave that environment completely.
Because of the radiology
disease. But they won't go. All those kind of things normally affect our life because there's pulse that normally emitted from that machine. You understand? Then make sure you have enough trees or plants in your environment. As you are breathing in your carbohydrate, carbon dioxide, you are taking in oxygen from the tree.
Wow. So how effective are these lifestyle, these measures that we just talked about? How effective are they in slowing down this disease?
It's highly effective. You know, mostly if we have cancer, if you can make some little changes about your lifestyle, things will change drastically. What you are taking in, it will change drastically. Wow. You understand?
Yes.
If you are the kind of person that's living within the environment where there's a pollution through the powder of maybe the cement or some other factory that's within the environment, if you move away from that life, the kind of life, and live far away from that place and eat something that is balanced, if you come back to that environment, that location, they will ask you, what kind of life are you living? You have changed.
What if someone does not have the financial capability to move
away from that
area? What can such an individual do? At least separately
within your environment.
Within my environment, this is what I can afford. This is the place I can stay.
It's possible. You have to at least do your exercise.
Okay.
Often.
Okay.
You understand?
Yes.
Then you can meditate occasionally. Then at the same time, if by adventure you find yourself outside that place occasionally, eat something that you know is what? Balance for yourself. So,
wow, this is really, really great. Please, I want us to keep dropping in our questions because very soon I'm going to visit the comment box and take in our questions and contribution. So this takes me to my next question, sir. That's question number 5. How can family members, caregivers, even community provide the right physical, emotional, and also social support to someone living with Parkinson's disease?
That is the great work, I want to say. Yes. Because for somebody who has been moving around before and having that particular challenge, emotional challenge is number 1. But at times I've been number 2 to those kind of people. They want to express themselves.
Yes.
They won't be able to. They will be crying. If you are in position, if you are one of those that normally take care of some kind of people, you need what they call adequate patience with them. Okay. They want to talk. You cannot preempt what they want to say. And they want to write, they cannot write because their hand is shaking. So you need to be patient with them, allow them to speak their mind and give you the information they want to speak. Okay. Education about what is they are really passing through is number 1. The person wants to take care of them, the caregiver, the family, or the relative that are very close to them. They need to educate them, to let them know what this person is going through. And it needs you at that particular time. You understand? Yes. It needs your utmost patience. So if they can educate them, number 1. Then number 2, support, emotional support is there. Daddy, don't worry, you make it. It's just a matter of time till you go. You understand? Talk to them. And those who are the children and the family, they need to be seeing them occasionally, coming closer, so that they will not just abandon them and run away. You understand? Yes. This is very, very essential. Patience with these people. Patience.
What about some community that they find themselves? You know, some of us we get discriminated.
Yes, because we don't know
you are passing through some kind of situations like that.
Exactly. And the people can turn again.
But nobody knows. Nobody believes that people can turn.
So that's why I'm talking about the education.
Okay.
Both the community and the family and the caregiver.
Yes.
They need to be educated about what this person is passing through. Nobody can run away from it. It can put anybody at it. You understand?
Yes.
That education aspect of it is very essential. It is when, in fact, this kind of a thing normally makes some women divorce their wife.
Of course, you see you cannot do anything again. See your mates. They start saying a lot of things to such a man.
I don't want to mention anybody's name.
I understand.
One of our Nollywood actor that is passing through this particular challenge now. The only thing that is keeping that man alive.
The Bluetooth device is ready to pair.
The only thing that is keeping that man alive happened to be his wife and his children that supported him. If not, that man would have gone since. Wow. That man would have gone. Wow. Wow. So at times when that kind of a thing happens, the family, the relative, they need to remember sometimes when that person was agile and he or she is available for them. Very essential.
It is well. Wow, this is really this topic is really touching me. So this takes me to my last question, sir. Finally, as a renowned KEDI consultant, you have many years of traditional Chinese medicine experience. I would like to ask you, sir, since one of the symptoms of this disease is connected to the brain and also memory health, and we know that KEDI Healthcare, we have so many products. We have some products that support memory health. And in our practice, in what scenario would you say, or would you recommend these products?
Such kind of person does not need blood circulation. You understand? I think you get what I'm talking about.
Yeah.
But VIP massager is good. But if you want to use blood circulation massager, there's another way to use.
Just put us
You understand? But there are some other products that can help faster.
Okay.
One of them is Celeq10, KEDI Royal Jelly, Memory 247, Ultra Mega. You see those 4 products I mentioned, they are top notch for the Parkinson's disease. You can have to receive because you want to supply the heart through the pumping of blood to the brain. You understand?
Yeah.
If you can have those 5 products together, and we now use blood circulatory or VIP massager, you will get a better result. Get a better result. I've done it in the past. Some people like that. And you see a lot of people.
Could you share us your dosage rates? How you apportion this
initially, if I want to use Godesis for such kind of people, even the stroke patient, I normally recommend 2 in the morning, 2 in the evening. You understand?
But the first Godesis
for the first 2 weeks, 2 in the morning, 2 in the evening. After that 1-2 weeks, they will now go back to normally 2. And that 2 can be taken once, or 1 in the morning, 1 in the evening. You understand? Then the memory 247 is always in between me, morning and evening. You understand? Then KEDI Royal Jelly is 3 capsules after me, like 15 to 30 minutes after me, morning and evening. Then Celeq10 is same thing with what do you call it? Memory 247, morning, evening, in between me. So, then Ultra Mega, the same thing. In fact, that Ultra Mega, I love it so much. Even my family love it. My kids, they always chew it like chewing gum. Take 1 in the morning, take 1 in the between.
Wow.
Perfect.
Wow.
Perfect. Because omega-3 is highly essential for the brain. Very essential.
All right. So, do you have any testimony you would like to share with us? Possibly you have treated one patient or the other who has suffered this Parkinson's disease and the current state of the person.
The Bluetooth device is connected successfully.
Treated that particular challenge. You understand? And the person today, though he is no more, but before he passed on, he regained his health.
Wow.
And one of my downline too, understand, of blessed memory too, he has little challenge with that one, and when he started using the product, it changed his appearance.
Wow. All right. Let's take a few of our questions now from the comment section. We have all edit all from Mr. KEHINDE Adeyemi. So now over to our questions from the comment section. Please, if you still have your questions, please rush now and drop them down to the comment section. I'll take from our Instagram handle. This is coming from Toke. She says, is Parkinson's disease curable?
It's not totally curable, but it can at least be variable. You bring it down to some variable level.
Okay.
You understand? Okay. It's not totally curable. All
right. Also from our Facebook page, Kate says, are there KEDI products someone can take to prevent this disease? You have talked about it, but probably you can relay it again so that this person can.
I mentioned Godesis, Memory 247, KEDI Royal Jelly, Celeq10, and Ultra Mega.
All right.
Okay, so without further ado, if you're just tuning in for the first time, this is Talk to Kedi, and our guest, Mr. KEHINDE Adeyemi, has exhaustively discussed Parkinson's disease. Thank you so much for tuning in. It's time for us to take our Dr. Cap health tip for today. Sir, could you do us the honor of reading out the Dr. Cap 80?
Parkinson may start quietly, but its impact grows loudly. The earlier we act, the stronger we fight. Listen to your body. Seek help early. Support others. Because awareness today can protect the movement, voice, and life we cherish tomorrow.
Wow. You have heard it from our guests. I will take the last line that says, awareness today can protect movement, voice, and life that we all cherish. With that, it is a wrap on this edition of Talk to Kedi. I hope you have learned something valuable about Parkinson's disease. Special thanks to our amiable guest, Mr. KENNY Adeyemi, for taking time out to share with us from his wealth of knowledge. You're welcome, sir. And in case you join this broadcast late, don't worry. The full video will be available on our Facebook page at KEDI Healthcare Industries. It will also be on our Instagram handle at KEDI Healthcare_official. It will be on our YouTube channel at KEDI Healthcare. You can also log into our mobile application, that's KEDI Care app. Feel free to watch and share with your loved ones. Don't forget to join us in the next edition of Talk to Kedi, because it promises to be insightful. Thank you so much for tuning in. Till I come your way next time, I'm Felix Adedoyin. Bye for now.